How I help patients with low back pain depends upon what's causing that low back pain. The three most common types or causes of low back pain, it comes from joint pressure, nerve pressure, or disc pressure. So depending upon where their specific condition is, we target that. So for example, if they have pressure on the disc, it's usually due to muscle spasms that are cramming the bones together in the spine, and that pinches or pushes the disc together that causes it to bubble out, kind of like a water balloon. When you squeeze it, it gets fatter. So if we specifically do some therapies to help diminish the tension in the muscles, take the pressure off of that disc, then it's not pushing on the nerve as much and we get some relief. Ultimately, to maintain that as normal as possible, we do adjusting. And the adjustment helps take some of that pressure off the disc as well by properly aligning the bone so that it's not being a part of that problem. If the problem is coming from the joint, again, the joint gets swollen, and that pressure and swelling in the joint causes the pain. So again, we would do some gentle adjusting to help relieve the stress and the pressure in that joint. We do some specific therapies like traction or electrical stimulation. The traction to help take the pressure and the tension out of the muscles, the electrical stimulation to help the muscles start to function a little more normally. We can set it up so that it reduces the spasm, how hard the muscle's spasming, and also just to help give you some relief from that respect. If the specific problem is coming from a nerve, pressure on a nerve, then again, we have to move the joint, the bone, with the adjusting very gently to take the pressure off of the nerve so that, again, the swelling is reduced. And that again comes into the therapies that we use as far as traction to help reduce the tension in the muscles that are cramming everything together that's pinching the nerve. Electrical stim to help with the inflammation, to help with the spasms. And the ultimate goal is to reduce the inflammation and to have the joint moving more normally so that there's less pressure on the joint, on the disc, or on the nerve.